Mom, I asked it for cold water.
It's there. It's there. Should I start? Good morning. I want to thank you and welcome you for joining us. I am Marjorie Jean-Jacques, the Executive Director of the North Brooklyn YMCA, and I'm excited to be here with all of you. The Y is committed to doing everything in our power to support the city of New York, strengthen communities, and serve those in need. Excuse me. This last year has been unbelievably difficult for all of us and for all of our communities, and we are anxious to return to normalcy. That will require protecting our communities and each other, and vaccination is one of the tools that'll help us get there. The CDC recommends you get COVID-19 vaccine as soon as you are eligible, but we know our community members want accurate information about the vaccines and that they may have questions for doctors. To empower our communities and support our vaccination education efforts, we are honored to partner with New York-Presbyterian to host a series of 12 webinars to discuss everything you need to know about vaccines. For more resources, including eligibility and scheduling information, we'll discuss that at the end. Today, we'll hear from two people. Dr. Onyinye Balogun, the attending radiation oncologist at New York-Presbyterian Brooklyn Methodist Hospital, and Ms. Amy Calvi, Chief Program Officer at JASA, the Jewish Association for Serving the Aging. Dr. Balogun is the Assistant Professor of Radiation Oncology at Weill Cornell Medicine, specializing in treatment of breast and gynecologic malignancies. She's a graduate of Harvard and Yale University School of Medicine. Dr. Balogun initiated her residency training at the University of Chicago and completed her final year at New York University. She has conducted and published breast cancer research in novel therapeutics for triple-negative breast cancer and brain metastases. She is also engaged in gynecologic cancer research as well as global health activities with a focus on improving the delivery of radiation therapy in low and middle-income countries. Good morning, Dr. Balogun.
Good morning, Marjorie, and good morning, everyone. Thank you so much for having me. It's an honor to be here. So I wanted to first of all thank the YMCA JASA for inviting me to give this talk today. It's a full disclosure, we begin talks in the medical field, we list our disclosures, and my disclosure is that I'm very biased. Unfortunately, like many of you, earlier this year, our family suffered the death of my uncle due to COVID. So we had gone, all of 2020 without anyone really coming down with the illness. And at the beginning, actually, of this year, we've had both a great aunt of mine and an uncle die. So I feel particularly strongly about this topic. And all I want to do today is to empower you, to give you some information so that you can make an informed decision when it comes to the COVID-19 vaccine. So I will share my screen, and I'm just looking forward to a robust discussion with everyone. All right, so all right, so when it comes to the COVID-19 vaccine, the main question on anyone's mind is, why should I get vaccinated, right? And I would say that there are three main reasons. The first is to protect yourself. The second is to protect your family and your community. And the third is to help end the pandemic. So just to delve into those reasons a bit more, protecting yourself from the COVID-19 illness means that you are going to get this vaccine in order to not have symptoms. The COVID-19 illness can manifest with a lot of different symptoms, cough, fever, congestion, shortness of breath, fatigue, even diarrhea, and muscle or body aches. And I think some of these symptoms kind of sound like the flu. And if you'll remember early on, some people were saying, oh, it's just like the flu, nothing much to worry about. But what we do know is that even though some of these symptoms may be similar to the flu, the severity of these symptoms and their complications are not like the flu. This illness can cause a lot of complications in different systems of your body. And currently, over 1.6 million people have been hospitalized with COVID-19 in the United States. And unfortunately, over 500,000 deaths have resulted nationwide. So we're still learning more about how COVID-19 affects different parts of your body, but you can have a different number of symptoms. And long term, COVID-19 can cause multiple systems in your body to have problems. From my discussions with my colleagues who are seeing these, what you might hear about called long COVID patients, it can cause heart problems, inflammation of the heart. It can cause worsening kidney function. It can cause your body to have blood clots. And if you have blood clots in the lungs, that can cause breathing problems or even death. People have also reported brain fog, issues with your nervous system that we don't fully understand, and of course, lung damage. So we don't yet fully know how long these issues last. What makes each person have symptoms for a short period of time or a long period of time. Because unfortunately, what we've seen is that initially we said, oh, it's really just an illness of the elderly, but anyone can get affected. Right now, I think a lot of people are reporting that they're seeing the majority of their patients are 40 and under as the vaccinations have rolled out. So we want to make sure that you protect yourself and of course that you protect your family and your community. So when you get the vaccine, you have a much lower chance of coming down with COVID-19. And we know that right now, the vaccinations that have been authorized, they range from 80 to 95% effective at stopping severe COVID illness. Most importantly, none of the people who've gotten vaccinations on these trials have died. So that's something so remarkable and so important because we don't want any more loss of life due to COVID-19. And when you get COVID-19, they've also shown, I think just as recently as this week, that you're much less likely to harbor the virus in your body. So this is really breakthrough information. We don't know if it's 100% effective at not harboring the virus in your body, but your risk of even carrying the virus goes down substantially. And what does that mean? It means that the people around you are less likely to get the COVID-19 illness. So we know that right now the COVID-19 vaccine has been approved for people who are 16 and over. And I think we just heard yesterday that it was also found to be effective in children who were 12 to 15 years old. But that means that younger people, we haven't tested it in infants. We haven't tested it in people who are younger than 12 yet. We don't know that data. And if we want to see, for instance, our grandchildren, I know my parents, part of their motivation for running out to try and get the vaccine is they wanted to see their grandchildren. And actually, my sons would say, don't you want us to see our grandparents? Why aren't you letting me see my grandma and my grandpa? So, that we want those family reunions. We want those hugs, to happen. We want those important visits to happen. So when you get the COVID-19 vaccine, you're not just keeping yourself safe, you're keeping your whole community safe, especially those who can't get the vaccine yet. So do the vaccines work, right? And the short answer is yes, the vaccines work. All of the COVID-19 vaccines that are available in the United States are highly effective at preventing the COVID-19 vaccine. So I know you've heard probably of Moderna, you've heard of the Pfizer vaccine. Those both require 2 shots. The Pfizer vaccine is given 21 days. After the first shot, you wait 21 days and you get the second one. With the Moderna vaccine, you get the first shot, 28 days later, you get the second one. The Johnson and Johnson vaccine is just 1 shot. So you've heard of a number of different vaccines that are available. And we say that the best vaccine is the one that's available to you, because all of them have been tested. Each of them have been tested in over 30,000 individuals. And we did not see any significant severe side effects. And they were effective at preventing severe COVID-19 illness as well as death. Is the vaccine safe? Right? That's a question that a lot of individuals ask me. And I'm happy to say that I can confidently say that the vaccine is safe. Yes, it was studied in tens of thousands of people, each one studied in over 30,000 people. And in the United States, more than 45 million people have received a COVID vaccine. Importantly, no substantial safety concerns have been identified. So we know that working with vaccines, it's very unusual for a vaccine to start causing problems more than 8 weeks after it's been administered. And for all of these studies, the Moderna, the Pfizer, the Johnson and Johnson, were more than 8 weeks out. And we have national databases where people are supposed to report their side effects, and physicians are also supposed to report into those databases. And we just haven't seen anything to warrant stopping vaccination. There are no substantial safety concerns, and I'm very happy to emphasize that point. And now one of the areas of concern for several people is, well, can I trust this vaccine? It was made much faster than all the other vaccines. So is it safe? Can we truly say that it's safe? So when it comes to making vaccines, there are actually 4 main categories that go into the steps of making a vaccine. The first is research, right? The scientific basic research that you have to do. The second is clinical trials. The third is FDA and review. And the fourth is production. So, my take on this is that the messaging regarding the vaccine wasn't 100% accurate, and that that kind of influenced how people look at the vaccine. So when it comes to the first category, research, the COVID-19 vaccine is based on decades of research. People made it seem as though we just found out about this new virus in January of 2020, and suddenly there was this flurry of research, and suddenly we had a vaccine. The COVID virus, right? Or we call it SARS-CoV-2, because there was an initial SARS virus that came out. And once that SARS virus was found, people have been studying it to see how can we create a vaccine to this. Also, there's something called the Middle Eastern Respiratory Syndrome. That virus is also similar to SARS-CoV-2, and we've known about it for some time as well and have been studying it. So the COVID-19 vaccine is not just based on what we knew as of January 2020. It's based on decades of research. So that initial research gave us a leg up. It gave us an advantage so that we could move quickly to produce a vaccine. So second, the timelines when it came to research were overlapped in order to speed up the process. And I'll talk more about the clinical trials with the next slide. Most importantly, all of the same safety standards and expert reviews were used for the COVID-19 vaccine. We didn't do any shortcuts. There were no shortcuts or, cutting corners when it came to testing whether the vaccine was safe or not. So going back to that second category of research, of clinical trials, this is the traditional vaccine timeline, and it can take 15 years or more, usually, for a vaccine to be brought out to the public. What happened with the COVID-19 vaccine was that clinical trials were done in parallel, rather than first doing a phase 1, which is testing the vaccine's safety, just giving it to a few individuals and seeing is it safe. Then after you confirm that, moving to phase 2, which is giving it to more individuals and asking again, is it safe? And also, is it effective? And then after you finish phase 2, moving on to phase 3, which is comparing it head to head. In this case, they said we compare the vaccine to nothing. Instead of doing phase 1, followed by phase 2, followed by phase 3, what they did was to overlap the timelines. Towards the end of phase 1, as things were looking safe, they then started phase 2. Towards the end of phase 2, as things were looking effective and safe, they began phase 3. So that's how they were able to speed up the timelines. Also, when it came to production, in the United States, usually companies don't want to take the risk. They want the phase 3 trials to be done and for them to go over all the data before they start production so that they don't put money into creating a vaccine that's not going to be approved ultimately. What happened in this case was that the federal government took on the risk of the potential failure of the vaccine, and they began production while those phase 1, phase 2, phase 3 trials were in production, were undergoing, were in process. So production began at the same time as the clinical trials. So doing things in parallel really saved us time. When it comes to the FDA and CDC expert review, that process can take, on average 1 to 2 years. In this case, because we understood the importance, the significance of getting this vaccine out in time to save lives, they shortened that expert review from 1 to 2 years to 1 to 2 months. In a couple of months, we had FDA and CDC expert review. And again, I want to emphasize that there were no shortcuts. They didn't say, oh, well, usually we want vaccines to be this effective or this safe, but we'll, let it slide for the COVID-19 vaccine. Absolutely not. They had to meet the same standards, the same targets as normal vaccines. And so now the question is, will this vaccine hurt my community? We know that a diverse scientific community came together to create these vaccines. And that was something that was also unprecedented. We had scientists from Europe, we had scientists from the African continent, from North America, from South America, working hand in hand to share research so that we could accelerate the timelines and get the vaccine out to people. Also, importantly, we know that the vaccine trials included a diverse population. We had Black and Latinx communities represented. Importantly, we know that those are the same communities that have been really hard hit by COVID-19. And so it's so important that we address any concerns within those communities in order to make sure that we can get back to a healthy and normal way of living. When it also comes to those trials, I want to emphasize that we also had diversity in terms of age. We had people from 16 to 75 and older on those trials. We also had individuals who have a number of underlying clinical conditions, diabetes, high blood pressure. We know that those are some of the conditions that can increase your risk of getting COVID-19. And those individuals participated in the trial, and we did not see that the vaccine did any harm to them. So I would encourage you, if you are in a higher risk population, the vaccine was tested in your peers and it was safe for them. So now something that's been coming into the news of late is new variants, right? As the viruses spread, they may change. And that's why we're working so hard to get people vaccinated, because the longer the COVID-19 virus is out, or SARS-CoV-2 is out in the public, it can morph. And what happens is when the virus changes, it can gain an improved ability to infect you. That's what we've seen with the UK virus, the B17 virus strain. it can also sometimes get better at avoiding your immune system, right? So we don't want those things to happen. We don't want the virus to start having mutations that might make it even more infectious or better able to avoid our immune system. So it's important for us to make sure that we get vaccinated, because vaccination is our best tool to stop new variants. I want to also emphasize that the data thus far show that with these vaccines, we are still effective at stopping the variants, right? So some people say, why should I get vaccinated? There are new variants. Will the vaccine even protect me? And thus far, the evidence shows that for these variants, the vaccines that we have available are still able to protect us from getting really sick. So it's so important that we get vaccinated so that we can protect ourselves from these new variants, from the original SARS-CoV-2 virus as well. So when it comes to different resources to make a vaccination appointment, we have these. Of course, if you've been a patient at NewYork-Presbyterian, we have clinics at the Armory. We also have availability in the New York Presbyterian Brooklyn Methodist Hospital, I'm proud to say. There's also a site, I think, in Bensonhurst. And I think, Amy, Marjorie, and Rachel on the call can also provide more information. Of course, we have the NYC COVID-19 vaccination hotline that you'll see here, as well as the New York State vaccination hotline. And Somos NY also is making vaccinations available. So we'll make sure that all of this information is available for anyone who's seeking vaccination. So it's going to take time for everyone to be vaccinated, but in the interim, we need to keep doing what we know works, and that's wearing a mask, right? If you can, double mask, because that's shown to, keep out over 90% of virus particles. Make sure you wash your hands. Simple, basic soap and hot water will do a lot to decrease your risk. And also keep your distance. Individuals who are not in your household, 6 feet, right? That's the rule. I think the CDC recently came out to say 3 feet, but if you can keep some distance, that's ideal. And we know you have questions, and we are ready to give you all the information that you need to make a decision about the vaccine. And these are just some of the questions that may come up that we can discuss, but I will just, take this time to wrap up and to thank everyone for listening. Thank you.
Thank you, Dr. Balogun. Next, we're going to hear from Ms. Amy Chalfie, who is a 30-year-plus veteran of JASA, currently serving as the agency's Chief Program Officer, where she coordinates programs reaching over 40,000 older adults with life-enhancing services. During her tenure at JASA, she has served in several positions, including Associate Director of Group Services, Bronx District Director, Director of Mental Health Services, and Director of Programs. Amy has played a leadership role in expanding JASA's service continuum, particularly in the area of NORC, naturally occurring retirement communities, supportive services, case managers, and elder abuse, prevention and intervention, and tenant services. We're looking forward to hearing from you, Amy.
Thank you, Marjorie. And thank you, Dr. Balogun. And certainly thank you to the YMCA of Greater New York and New York-Presbyterian. I'm very appreciative to be a part of this presentation today. Good morning, everyone. Just a couple of things to start with. So I tend to see myself as a professional in a social services organization. JASA reaches a lot of individuals across the city, over 40,000 every year. But I'm also a person who's 67 years old and has high blood pressure. And I was very grateful to be able to get the vaccine. I had my second dose at the beginning of March. I had no real discernible reaction to that except a sore arm. And I am so, really, I'm going to use the word grateful again, but to be able to protect myself and those I love, and to contribute to ending this virus. So we are, I guess it's an understatement to say certainly that we're in unprecedented times. It seems incomprehensible that that more than 500,000 people have died across this country, and what that means to individuals when it's a member of their family. And at this time, New York City remains a coronavirus hotspot, with new cases holding level at about 25,000 a week. That's extraordinary. Dr. Ronald Braithwaite, he's a professor at NYU, has said we're in a tug of war between the virus and the vaccine. And so we want the tug of war, we want the side with the vaccine to win sooner than later. And we have an opportunity to do something about that. At JASA, we believe we have an obligation to help older adults get the vaccine, and we have been able to help several thousand older adults receive it. I just want to tell you that after people have been vaccinated, what our staff hear are things like, I feel confident. I feel like I have my life back. I'm better able to manage my life. I feel safer. I'm not so worried that if I go food shopping, I'm going to bring something home to my family. One of our program members actually said, she said, I feel like I have superpowers now. I'm not suggesting a vaccine is a superpower, but it does change the whole way it changes the way you can operate in the world. I just want to say that in JASA's experience, so many more people from the onset of this virus, so many people who never felt vulnerable before, who felt really as if, yes, I'm older, but I'm managing, I go about my business. Suddenly, so many more people felt vulnerable and insecure and had difficulty getting food, difficulty getting to the doctor for what you would consider regular visits. All these things stopped and people had to scramble to find alternate ways of making their life whole. This is another way to make your life whole by getting this vaccine. So at JASA, we have focused on several fronts where we try to be a resource for accurate information as it becomes available. And we, for example, through our programs, we have about 70 different programs at JASA. We distribute material in different languages. We can't always have a staff person who speaks the right language, but we try. We pull staff from different programs to help with that. We promote access. It's important, we believe, to appreciate and respect concerns that people have about the vaccine. They're meaningful to you as an individual, and we want to be able to answer those and help you work through how this can work for you. So we try to provide the right information. We certainly identify vaccination sites with appointment availability. We assist clients in making appointments and help them get the transportation to get there. And we host clinics in partnership. A big shout out to New-York-Presbyterian, who's been a real partner in ongoing vaccinations for clients in many programs, in many JASA programs. And we, of course, work with the New York City Housing Authority, New York City Department for the Aging, as these pop-up clinics come around. We were able to get our senior housing sites registered in the federal program so that tenants of all, we have 10 buildings, tenants in those 10 buildings were able to be vaccinated right there in the community rooms. As one person said, she was so grateful just to be able to take the elevator down to do this. And we had over 2,000 JASA tenants vaccinated in this way. That's out of approximately 2,200. So now we're busy trying to help the remainder get to an appointment. And what we saw was that momentum grew. In other words, the first time the vaccine clinic was held, well, maybe there were 100 people, but then they told their neighbors. And then the next time we had double or triple that. So we recognize that sometimes you have to see what your neighbor's doing, what your family member's doing, or that gives you confidence to proceed. So just over 100 days into New York City's vaccine campaign, it turns out that about half of those 65 and older have received at least one dose of the vaccine. I'm not suggesting that things haven't been challenging, but it's been great to have pop-up vaccine clinics at senior centers, at what we call NORC programs. Some of you may be familiar with that term. That means naturally occurring retirement communities, like Co-op City has a lot of older people. That's a NORC. There have been vaccine clinics there. And there are more and more opportunities each day they're opening up. And there are so many people committed to bringing it to you. Just a word that JAS's website updates offers COVID-19 updates around eligibility and availability. And I know that resources will be announced at the end of the program, but just in case, it's www.jasa.org. I was reading an article by Liana Wen, who is a doctor. She's often on TV, and she used to be Baltimore's health commissioner, and she participated in a vaccine trial. And one of the things she said was that she was proud because she's part of an effort that's helping to end this deadly pandemic. Of course, it's the scientists who developed the vaccines who should take a bow. And when it comes to this remarkable achievement, but it involved so many people. And they were all instrumental to the rigorous science that went into developing it. And so her quote was, "At a moment of great global peril, they developed vaccines that are safe, effective, and life-saving." So I hope you feel at ease and confident about taking the vaccine. It's waiting for you to take it, and it will help you and your loved ones be safe. So I think that's where now we can open to questions.
Thank you,
Thank
Amy.
you again.
Thank you. I can hear the passion in both of your voices when you talk about this and just trying to educate people and provide as many resources as possible. So we ask the audience, if you have any questions, to please post them in the Q&A. The first question we have is, I'm post-vaccinations. How often should I consider a COVID-19 testing?
So that's a great question. So if you're post-vaccination, you should get tested in 3 circumstances, I believe, according to the CDC. The first is if you have symptoms that you believe are concerning for COVID-19. So we talked about that: congestion, fever, diarrhea can even be one of the symptoms associated with COVID, muscle aches and pains. So if and one that's really common that people talk about is losing their sense of taste and smell. So if you notice anything like that, definitely go and get tested. The second is if you're asymptomatic, but you believe you've been exposed to someone who has tested positive, then you certainly need to go and get tested. And I'll tell you something, vaccines work. Personal story. My husband and I are both physicians, and we got the vaccine pretty early on. And I started to have some congestion, and I was so concerned and I was worried. I wondered, did I still get, COVID-19? I got tested, I was negative. He got tested, he was negative. Unfortunately, our babysitter, who didn't yet qualify for a vaccine, she actually told us a few days later that, or a week later, she got COVID-19, but we both were negative and we're just dealing with the common cold. So it's such a relief to go back to just, I'm dealing with a cold, I'm over it in 2 days. But if you are exposed to someone who is positive, you have to get tested. And then finally, if you think you've maybe done like a high risk activity that could have exposed you, then in that instance, you should also get tested. So if you're symptomatic, you've had an exposure to a person who's known to be positive for COVID-19, or you've had a high risk activity, let's say, you ended up being somewhere where there are a lot of people, you didn't have a mask, you're concerned, then you might as well go ahead and get tested post-vaccination.
Okay. Our next question is, will the vaccination prevent further infection with COVID and transmission to others?
So great question. So we've seen that the data thus far suggests that you have a very low risk of getting COVID. So it's 80 to 90% effective at preventing you from having a severe COVID-19 illness. And the data that came out this week suggests that people who get the vaccine are very unlikely to just be carrying the virus in their bodies and have the ability to pass it on to other people. We don't yet have solid numbers. We're not sure that it's 100% of people who are vaccinated that can't transmit it to others, but it's very encouraging that we've seen signs that you aren't just vaccinated and you're not showing the symptoms, but you have the virus in your body. Most likely you are very unlikely to have to come down with the illness, even if you do come in contact with the virus, and you're also unlikely to keep on carrying the virus in your body once you're vaccinated.
Okay. Next question is, I have antibodies from getting COVID. Is it still safe to take the vaccine? Do I even need it?
So that's I'm really glad that whoever asked that question, thank you. So a couple of points regarding that. When it comes to the COVID-19 vaccine, what happens is that they did a lot of research about which part of the virus is most unlikely to change. We know that viruses, mutate, right? We talked about the different strains that can happen over time. And what we've seen is the research said that there is a certain protein, the spike protein. They talk about the coronavirus and it has a crown. So there are certain spikes on the virus. And that's what a number of these different vaccines target. They show your body the spike protein. They say, look at this spike protein, make antibodies to this spike protein so that when the real virus comes into your body, you can recognize the spike protein, attack it, and your antibodies will kill it off. So when you are infected with SARS-CoV-2, the coronavirus, your body can make antibodies to the spike protein, or it could make antibodies to other parts of the virus. And what if you become infected with a strain that has mutated, right? That has changed a part of the virus that you made antibodies to? Your antibodies are now ineffective, right? So when you are relying on the antibodies that you form naturally as a result of being exposed to the SARS-CoV-2 virus, we're not sure that your antibodies are going to be as effective as the one to the spike protein, because we know that the spike protein does not change. It has not really changed from mutant to mutant. So we don't know if your antibodies are effective. That's a reason to go and get the vaccinated, because you'll be forming antibodies to the spike protein, the part that's less likely to change even if you come in contact with a mutated form of the virus. The second thing is that we don't know exactly how long your antibodies will last. People say it's maybe on the order of 3 months, but we're not sure. And so that's the other reason to get vaccinated. We believe that that's a more sustained response, and that your antibodies will last for longer. This is not to say that we're not going to need booster shots. We're still trying to figure out how often will we need to get booster shots. For instance, with the flu, we have to get a flu vaccine each year, right? But for the tetanus shot, you get a tetanus shot every 5 years. So we're not sure if it's going to be once a year, every 2 years, every 5 years. We're not sure, but we do believe that by getting vaccinated with the Moderna, the Pfizer, Johnson & Johnson, any of those, you're going to have more durable responses, and you're also going to be making it against the spike protein rather than other parts that may mutate in the future.
Okay. Next question is, what are the common side effects?
Great. So the common side effect of getting the vaccination, some people a lot of people experience soreness, kind of like with the flu vaccine, soreness at the site where you got the injection. So that's common. And then with the second, if you're getting a Pfizer shot or a Moderna shot, a lot of people have gotten symptoms that are similar to the flu. Some people get aches and pains, a little bit of muscle aches and pains, maybe some fatigue, maybe some fevers. So what people have said to do is to take, if you get those side effects with the second shot, take a Tylenol or an ibuprofen, and that should be sufficient to take those side effects. So for me, with the first shot, I had, significant arm pain. Some people don't have any arm pain at all. With the second shot, I felt a little bit of muscle aches and pains. I took a Tylenol, went to bed an hour early, woke up the next morning, and I felt okay. So I think, it's better to have those controlled, short-lived symptoms than it is to be exposed to the COVID-19 illness. And as we know, some people, have a few days of illness. Some people are still dealing with it a year after they've been infected. You don't want to play Russian roulette with your health. Okay.
Okay, the next one, which is a follow-up to the previous question, is suppose 6 weeks later, I'm still having symptoms from my second shot, like
Yeah.
feeling exhausted, dizzy, tired.
So that's more of an unusual side effect. I think I've heard of a few people who have had longer lasting side effects due to the vaccine. So I would definitely encourage you to talk to your physician. If 6 weeks out you're dizzy, that's very unusual. And you should talk with your physician because they will also upload it into that nationwide system, VERS system, where we're supposed to be able to keep track of the side effects that people have due to the vaccinations. So please get into contact with your physician. If you don't have a physician, New York-Presbyterian has an NYP Weill, where you can do a telehealth visit and get in contact with a provider, a healthcare provider, because we want to make sure that nothing else is going on, and that we report this accurately if it is a long-term side effect that you're having from the vaccinations.
Okay, I guess that kind of includes the next question, which talked about, the media reports that VAERS records more than 1,000 deaths related to vaccines, and I guess how they just wanted you to comment on that.
Okay, so I have to check back on the number of deaths that were related to the vaccine, because they put them in different categories. Is it possible, they're very careful. If someone had deaths that were around the time of the vaccine, they'll look and they'll investigate and they'll see. But I can promise you this, if people were dying significantly due to the vaccines, you would hear about it on television, right? Unfortunately, we get a lot of information from the media. They like to run with stories, and you would hear about it, especially from your healthcare providers. Myself and other physicians feel a duty to keep you safe. That's what we, dedicated our lives to. So when it comes to the deaths due to the vaccine, we've tested it in over 100,000 people were included in the trials for Johnson and Johnson, Moderna, and the Pfizer vaccines, and there were no deaths due to the vaccine on those trials. So that's over 100,000 individuals. When we roll it out to millions of people, it's certainly possible that some people could die due to the vaccine, because just on that scale, when you're talking about millions, billions of people, there may be deaths due to the vaccine. But I haven't heard about thousands of deaths due to the vaccine. I've kept a close eye on it, and I heard of one individual who may have had like a systemic reaction to the vaccine and died as a result of the vaccine. I've heard of maybe a handful, fewer than 4 other cases that were around deaths around the time of the vaccine, but not necessarily due to the vaccine. So I promise you that, you know, your doctors, it's not, you know, something that we would keep under wraps. If there were widespread deaths due to the vaccine. I know AstraZeneca vaccine, they kind of put a hold on it because there was concern about formation of blood clots in different individuals. I don't know that AstraZeneca is being widely used in the United States. I believe Moderna, Pfizer, and Johnson are the main ones, but AstraZeneca, there was a concern about blood clots. So I really have not heard about these thousands of deaths due to the vaccine. I will double check on VAERS. But when it comes to deaths, very uncommon. If you have a history of having allergies, you know, to vaccines, you have to talk with your physician about it. Even if you don't have allergies, when you go to get your vaccine, they're going to sit you down and observe you for about 10 to 15 minutes. If you have a history of having allergies, they may ask you to pre-medicate, or they will also likely observe you for much longer. But if you have a history of allergies to vaccines, please talk with your physician before going out to get it. And also, it's widely publicly available what the ingredients are of these different vaccines. So go online, you know, on the CDC website, a trusted source of information, and look to see if there are any components to which you may be allergic, and discuss with your physician as well before going out to get the vaccine.
Thank you. The next question is, what are some of the things you feel more comfortable doing now that you're vaccinated? But your children aren't vaccinated, so do you have restrictions for them?
So one thing that I do feel comfortable doing, I do feel comfortable meeting with family and friends whose behaviors I know and trust, so who've also been vaccinated. So that's the key part. If the adults have also been vaccinated, I feel comfortable having our children play together with masks, because we are less likely to transmit it to the children. They are less likely to have transmitted it to their children. So I feel comfortable in that setting. And if the children are going to school, I do believe older than 3 are supposed to wear masks. And we know masks prevent a lot of the transmission of this virus. So I feel comfortable interacting with adults who've also been vaccinated, because they're less likely to transmit it to their children. I feel comfortable going to museums. I love going to museums. I love art. New York City has a lot of that to offer. And I feel more comfortable going to museums. Of course, I will keep a distance from other individuals who are there, because they're not part of my household. I don't know their behaviors, their practices. So we keep, 6-foot distance, but we're going to enjoy what life has to offer. I feel comfortable going to the park. Of course, we'll use hand sanitizer, wear our masks, but I feel I want to get back to life. I feel terrible that the children have missed out on so much, but I feel comfortable doing my normal everyday things. I traveled recently. I had to travel, and I felt comfortable traveling. Put on the mask. The airline made people sit with a seat in between them. So I felt comfortable doing that as well. So I do feel comfortable doing a lot of things.
The next question, what if I have allergies, and what happens if I have an allergic reaction to the shot?
So if you have allergies to the vaccine, you have to discuss it with your physician so that you weigh the pros and cons and any pre-medication that's necessary. And if you do have a history of having allergies and you go in for the shot, they're going to observe you, okay, for at least, 30 minutes, if not more. because they really want to be careful to make sure that you don't have a side effect. So that's a discussion you have to have with your physician about the severity of your allergies to vaccinations in the past. And, you know, is pre-medication to kind of tamper down those allergies the best way, or are you just someone who's going to have to use precautions? So if that, you know, what I mean by precautions are washing your hands, wearing a mask. It's a discussion with your physician who knows your history. Okay.
Thank you. The next question is, which vaccines will be administered at the YMCA locations? I'll take that one. I know that at the initial Flatbush pop-up, it was Pfizer, but I'm trying to find out now what they're currently doing since we just started the site today. And if I get it before the end of this webinar, I'll let everyone know. Let's see, is there any other questions? Why are there 2 shots for Pfizer and Moderna versus 1 for Johnson & Johnson?
So great question. So what they found is, just based on the data that recently came out, 1 shot with the Pfizer and Moderna will give you 80% decrease in your likelihood of having a severe COVID infection. When it comes to getting 2 shots, that jumps up to 94 to 95%. So it may be that there's kind of like a booster effect, you know, you have some protection, some antibodies form, and then when you expose your body again to that spike protein, it amplifies, it increases the effect. So we know that 2 shots when it comes to the Pfizer and Moderna vaccine gives a bit higher likelihood of being protected than just the 1 shot. So it's probably just kind of a booster effect. Johnson & Johnson has also around 80 something percent, 80+% decrease in the risk of having a severe coronavirus infection. We know that with Johnson & Johnson, it was tested at a different time point. You know, it was tested after there were now, you know, different strains of the virus. It was tested in different settings, international settings as well. So I don't want people to think, oh, you know, I have 90 something percent with Moderna and Pfizer, and I have 80 something percent with Johnson & Johnson, and it's only 1 shot, so I should just only ask for Johnson & Johnson. People suspect that if you were to test the Moderna and the Pfizer in this setting, you may get similar results to what Johnson & Johnson got. So again, the best shot that you can get is the one available to you, okay? They are effective, all of them. They were tested in different settings, so you can't quite compare across the board. The best shot that's available is the one that you can get, because they are all, no one died. On those trials, no one died who received a vaccine. And that is one of the most important outcomes that you can have.
Thank you. We had a few people ask if this session was recorded and would be available, and it has been recorded and it will be available at ymcanyc.org/vaccinations. And Rachel did put it in the chat for people so they could save all of the links for the resources that were shared today. Do we have any last questions or any last closing thoughts you guys would like to share? You ladies would like to share?
So the last thing I wanted to say is that I quickly looked at the various information about how many deaths there have been after the vaccine. And so I think if people were supposed to show how many, the database, right? The VAERS database is supposed to just report, did anyone die, you know, after getting this vaccine? And I think about over 900 people, almost evenly split between Moderna and Pfizer, have died after getting a vaccine. What we don't know is that they died as a result of the vaccine, right? It does not say that all of those individuals died as a result of the vaccine. Sometimes, you know, people die of other reasons. And I assure you that if people were dying let's say someone healthy in their 60s, their 70s, they get the vaccine and they die. If we saw a lot of that happening, we would definitely halt vaccinations. But thank you to the individual that brought up that statistics. It doesn't, show that those individuals died due to the vaccine. And again, if we look at 900 plus people dying, God forbid it's due to the vaccine, but looking at the 500,000 deaths that we've had due to the coronavirus, we just cannot take the risk of continuing to expose ourselves to this virus. It is unpredictable and it takes a toll. We talked about the number of deaths, but if you count the number of individuals who are now suffering with long COVID, the people who can't, I have a patient who used to just walk around her house. She cannot walk from her bed to her front door without getting out of breath, If you count all the people who now have long-term issues as a result of the virus, I think if we weigh all things, the risks of getting the virus still far outweigh the risks of getting this vaccine. So I'm happy to discuss even more in person, but I would urge you to think long and hard about getting the vaccine, because for all intents and purposes, from what we have seen, it is going to decrease your risk of dying due to the coronavirus or having a serious, bout of illness or long-term symptoms. So thank you all for your time.
I would just also like to add, there are 2 new opportunities that have become available that for individuals who are homebound. The vaccines are available now, and if you need more information about that, that's available through JASA's website and the other resources I'm sure that are being posted. And also there's walk-in opportunities for individuals who are 85 plus, and if they're accompanied by someone who is eligible, that person can also get the vaccine. So again, there are new opportunities opening up. It's a very directed effort, and we're a big city, got a lot of people, but everybody is trying to work in concert to help end this virus and to make sure that the vaccine wins and not the virus.
Thank you so much, Amy. And on that note, I want to thank our amazing presenters, Dr. Balogun and Amy Chalfie, as well as our amazing partners, New York Presbyterian and JASA, for all the information that you've provided today and for the continued resources that you continue to share. All the recording of this and all the resources will be on www.ymcanyc.org/vaccine. I hope that everyone that was with us today found this information helpful and that you continue to be safe. Thank you.
Thank you.
Thank you.